Nasal polyps are swellings in the nose. They are, by default, they are benign, means not cancerous. And if you look inside the nose, often you find like a bunch of grapes. They are usually because of some sort of inflammation in the lining of the nose or the sinuses. Very rarely, nasal polyps could be a presentation of something more sinister, which is underlying, and it presents as a polyp. But majority of patients, by default, these are benign, smooth swellings, which arise from the lining of the nose or due to the swollen lining of the nose and the sinuses. We don't exactly know what causes polyps, but it is the underlying problem is some sort of inflammation. It is due to an inflammation in the lining of the nose, now which can happen due to allergies, due to something causing irritation of the lining of the nose, or because of some sort of infections. This is the broad, basic underlying pathology. It's very unlikely, very. And in medicine, we can't say nothing can happen. There's nothing absolute, but it's very unlikely the polyps will go away if we don't do anything. So nasal polyp, how do they present? Often the patient presents with runny nose, a bit of blocked nose or congested nose. They often complain of drip at the back of the throat. We call it post-nasal drip. Loss of sense of smell and taste is quite common. Sometimes if they are big and they are blocking the sinus drainage pathways, it can cause some facial pain, pressure, some headaches. And because they block the nose, they do result in snoring. These are the common sort of presentations of the nasal polyp. The nasal polyps, because they are due to underlying inflammation of the lining of the nose and sinuses, they are treated with steroids. Often we give steroids in the nose in form of nasal sprays to start with. The polyps can come in, they can be of different sizes. So usually the small polyps do respond very well to the nasal steroids, or sometimes even oral steroids or steroid nose drops. Of course, we can't give oral steroids or nose drops for a very long time because they have systemic side effects. But the newer generation sprays in the nose are pretty good point to start. If they don't respond, or if they're quite big and causing problems, then there's surgery for it, where we remove the polyps and open the sinuses. As I said, majority of these are benign. But if it's only on one side, you have anybody who has got symptoms on one side, and it's not just for the nose, it goes as a rule of thumb for the body. Any symptom which is just on one side should be seen, because very rarely this could be a problem. This could be just a red herring, and there might be a bigger sinister problem underlying. Now, again, the reason to contact apart from this is when you have a patient symptomatic, blocked nose, loss of sense of smell and taste, it affects the quality of life. If it's causing facial pains, headaches, as I've said earlier, then these are the common indications. But rarely, if it's unilateral polyp just on one side or symptoms only on one side of the face, then that should be addressed soon.